emergency.
Right now, when we talk about mental health responses, all mental health calls go to 911, which are police. When police come to a call, they come to it like a crime scene. Multiple cops, there's sirens, and they come with their uniforms, tasers, and weapons. When you call for someone who has a heart attack or a stroke, an ambulance shows up, and they give you care. Police come in as if I'm a criminal. We are people. People, human beings, people in crisis. I'm a person who lives with a mental health condition. When I watched Miguel Richards' video, I was really scared because the cops came for a wellness check. The man's house was invaded by police. He didn't do anything wrong. And what we need is more of a conversation when we're in crisis. It's not a criminal response that you're responding to. It's a public health response.
What do we want? Non-police response.
Systemic racism has an effect on social determinants of health for Black and brown people. In the course of a 5-year period, 14 out of 16 people who were killed by cops were Black and brown people. Correct Crisis Intervention today had several forums where they invited people from the mental health community to actually talk about valid concerns about interaction with police. And NILPI was there, which was fantastic. And that's how they actually connected with CCIT NYC. And we work alongside each other just to advocate for the community. But we listen to the peers and we listen to the mental health community to figure out their concerns so we can amplify their voices. Too often policies are actually designed and implemented without our input, and they do more harm than good. There's nothing about us without us. We meet with elected officials continuously. We meet with community advocates. We rally to accomplish the goal at the end of the day of protecting people. NILPI has connections to resources and is able to access body cam footage of Kawasi Trawick, Susan Muller, and Miguel Richards. This was so critical to our advocacy because they show that people are dying unnecessarily. It empowers the community, the mental health community, to take action. It keeps the elected officials and our key stakeholders on notice and let them know that we're always watching and listening. NILPI led the efforts in CCIT for the public advocate to change his position to have a more non-police response aligned with our CCIT NYC model. The city proposed a pilot program for alternative responses to mental health calls. They want to use EMT workers who are very connected to police, which we don't want. Also, the city wants to use a 911 call for the dispatcher to decide who call gets routed to. We hope that the city will be able to work with us so we can have a model that is more designed for the benefit of the community. What I see for the future is having an alternative number for mental health calls like 988. I see 24/7 mental health clinics on the corner like city MDs, respite centers where peers can drop off anytime they want when they're having a crisis as an alternative to going to the hospital or calling 911. I see more supportive housing for people in the community. That's what the future is going to look like for the people in the mental health community with NILPI at our side.